As of January 27, 2020, we have in China 4,428 infected and 106 that have died. Now one of those that died recently was Beijing's first reported death, and this is a 50-year-old gentleman who visited Wuhan on January 8 and developed fever 7 days later. The 15th went to the hospital on the 21st and then died on the 27th. Now over the past day or so there's been some epidemiologists in China that have looked at this, and they're trying to parse exactly how well the containment or quarantine of this area is, and they've come up with some pretty sober results. They say that optimistically if we were able to get a 90% containment of the area, they predict based on their models that the peak infection would hit about 59,000 people, and that would mean that would be about 1,500 deaths. If the containment was worse than that, and there's been some news about that recently because the mayor of Wuhan said that about 5 million people went out of the city after there was the virus, and so if you look at a worst-case scenario of only 50% containment of the area, based on the models that they've come up with, is 5 million people being infected and a death rate of about 100,000 people. Things have kind of heated up. We have Sri Lanka has its first case. This is a Chinese tourist that went to Sri Lanka, and this patient's being hospitalized in the capital of Colombo. We have the United States ordering a level 3 alert saying no non-essential travel to China. We have a quarantine in China of about 50 million people, and one of the areas that are really going to be of high interest in this whole idea of whether the virus can be contracted when the patient or the index case is asymptomatic. This claim was first made by China's health minister, but there is growing concern, because the United States and their health department personnel have been unable to look at the data in China, because they're not being allowed to look at that data to see exactly how is it possible that somebody who does not have symptoms is able to transmit the virus, and so they are not exactly able to back up that claim as of this moment. Better news is that there have been no new confirmed cases overnight in the US, so they have got 4 or 5 cases, 2 in California, 1 in Los Angeles County and the other one in Orange County, 1 in Washington State, and that's an interesting story in and of itself. So in Washington State, the index case themselves is a gentleman who actually went to the market in Wuhan, and currently health investigators are looking at about 64 different people that he might have had contact with, and they're tracking them down and seeing whether or not they have the virus. So far the index case himself is doing fine getting back to California. As mentioned, there are cases in Orange County, and also in Los Angeles County, but what was just recently announced is that Ontario International Airport is going to be the repatriation center for about 240 Americans who are going to be repatriated back to the United States out of China, and that is a chartered flight. It is first going to go to Anchorage, Alaska for refueling, and it's at that point that they're going to have their first health check, and then it will be going on to Ontario International Airport in Southern California, where they're going to be screened to make sure that they're not sick, and to make sure that they don't have the virus. In the last few hours at the writing of this report, a piece of interesting news came out of Canada, is that there is a case in Toronto of the patient who came from Wuhan and is currently in a hospital there in Toronto called Sunnybrook Health Care Sciences. Interestingly, the husband is in hospital, but the patient's wife has also tested positive for the coronavirus. However, she's at home and she's doing quite fine without any symptoms. This is an interesting illustration of how variable the presentation can be of this virus in different individuals, and it's assumed that they both picked it up at the market there in Wuhan, China, and hope that the husband did not give it to the wife. If he did, then that would be the first case of a human-to-human transfer outside of China. So far there has not been any evidence, at least in the United States, or in fact anywhere else in the world other than China, where there has been a human-to-human transmission of this virus, so that's good news. Thanks for watching. Please subscribe our channel for more video.